Okay. Let's discuss about an autoimmune disorder which is antiphospholipid antibody syndrome. This antiphospholipid antibody syndrome associated with the SLE leads to thrombosis. In this condition, it can be of two types, that is primary antiphospholipid antibody syndrome, secondary antiphospholipid antibody syndrome. In this condition, the most common clinical manifestation will be the deep vein thrombosis. And let's look into the further about the autoantibodies and also clinical features seen and also investigations in this video. Let's discuss about an autoimmune disorder, antiphospholipid antibody syndrome. Antiphospholipid antibody syndrome APS along with systemic lupus erythematosus known to cause thrombosis. It is an autoimmune condition. It is of two types, that is primary antiphospholipid antibody syndrome, secondary antiphospholipid antibody syndrome. And the most common clinical features seen in these patients are deep vein thrombosis, which is most common clinical manifestation. Livedo reticularis is seen, and the patient, as this condition, patients are more prone to development of thrombus. Stroke can occur in these patients. Most common manifestation is the arterial thrombosis. Even migraine also found, migrainous attacks, headaches also seen in these patients. Limb sacs endocarditis, that is cardiac wall disease, also seen in these patients. Epilepsy is seen in these patients. Even chorea, that is abnormal movements, also seen in these patients of antiphospholipid antibody syndrome. In case of pregnancy, these patients often experience early fetal loss, late fetal loss, or premature births, or 3 or more miscarriage. Whenever the pregnant female gives a history of 3 or more miscarriage, then we need to think about this condition, that is antiphospholipid antibody syndrome. And also patients also have the symptoms of autoimmune hemolytic anemia features like dark urine, etc. And let's see the autoantibodies seen in this condition. The autoantibodies seen are anti-beta 2 glycoprotein antibody, which is detected by ELISA, anti-cardiolipin antibody, which is most sensitive antibody in the detection of APS, and also lupus anticoagulant, which is most specific for antiphospholipid antibody syndrome. Let's look into the treatment plan that is available. If the patient is asymptomatic, then there is no need for any treatment. For in case of adults, heparin, warfarin, low molecular weight heparin has to be used. In case of venous or arterial thrombosis has occurred, then warfarin is the mainstay of treatment and INR levels has to be monitored in these patients. In case of pregnancy, first pregnancy there is no need for any treatment. For recurrent pregnancy loss, prophylactic heparin along with low dose aspirin has to be given. And if the patient presents with thrombocytopenia, that is less than 50,000 of platelets, then prednisolone, IV immunoglobulins and rituximab has to be tried in these patients. And this is in brief about the condition, and thank you for watching.